Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi, Dr. Darrow.
Hello, Nita. How are you today?
Terrific. Yourself?
Living it up as always, Nita. You know that.
Oh, I love that. I love
never
that.
change my story.
That's what keeps us young.
It really is, isn't it?
So what should we do about our listeners who are in chronic orthopedic pain?
Well, you were going to ask a question, but then you kept talking. You
Yes.
confused me.
Sorry, darling. Go ahead.
Well, it's pretty simple. These days we're doing regenerative medicine. When I say these days, lots and lots of doctors are doing it now. It still isn't in the traditional medicine realm yet because we've got a lot of old dinosaurs out there that are still doing surgery and giving people medication. And I know some of that's necessary, but for the most part, you and I both know, and all my patients know, that it's a lot easier to walk in the office and get an injection with cells from your body, platelets or stem cells, and heal the area up, regenerate, rejuvenate, instead of cutting tissue out and immediately causing arthritis, which is a terrible thing to do because when a surgery is done, the area is generally destabilized, and then another surgery comes along when you tweak the area again. And then eventually, if you continue to be active, you end up with a joint replacement, and then those joint replacements don't last either. And there's too many side effects. I have patients come in all the time that have terrible things happen to them, and I just hope to God I don't have to have any more surgeries. In my days of innocence before I knew about the issues that come up with surgery, I was on my track to do orthopedic surgery, and I was very excited about it. I used to go into orthopedic surgery as much as I could when I was in medical school, and actually, believe it or not, before I was in medical school, when I was doing my pre-med, I used to beg surgeons to let me come into surgery with them. I was so excited by it. It's a lot of fun. Not fun for the patient, but fun for the doctors, because it's, you ever hear of Tinker Toys? You're not a guy, probably not.
Oh, I do. I had a brother. Yes, of course.
Yeah, and Lincoln Logs and all those kind of
course.
things that we did as kids back in the day. I don't know what they have today. I had 3 girls in the most recent years, so we didn't do those kind of things. But back when I was a kid, I was just building stuff all the time. I was building model airplanes and boats and all that stuff. I didn't sniff the glue, though.
This is a good thing.
I actually didn't like the smell of the glue that we used. But my point is simple. Boys grow up to build things. It's a natural thing in our DNA, I think. And then moving into medical school, actually pre-med and then med school, I loved doing surgery. I was never the surgeon. I was an assistant because I was never board certified. But I love being in the operating room. Everything is meticulously done. The staff is amazing. It's very military in a sense of everything's done perfectly in the best way it can be. But the problem is, number one, there's human error, and that's unfortunate. You know, we've seen that with people calling the show who have had terrible surgical outcomes. By the way, I just want to give out the phone number a couple times because I don't want to blab on forever.
Okay.
I'd like to get some callers in here so we can bounce some ideas off. And if you have any pain in your body from orthopedics, meaning your joints, your tendons, your ligaments, things that cause you pain, neck pain, back pain, sometimes we can help with headaches if they're being generated from the back of the neck or the back of the head, and they're referring to the head. Also, every joint in the body I take care of, from the vertebrae down to the shoulders and the elbows and the wrists and the fingers and the hips and the knees and the ankles and the toes, and all kinds of syndromes, tears in the body, rotator cuff tears in the shoulders, and meniscal tears in the knees. There's just endless things that I take care of. I do inject the whole body, and if there's muscle tears, we can do that. A lot of people come in. We get a lot of people who lift weights, and squatting is a huge thing for them. I don't know why. I guess it puts on the most weight. It's the biggest muscle group. So they want to really bulk up on the hamstrings. And we get a lot of tears, and we can help those heal up. A lot of things like lateral epicondylitis, which is tennis elbow, medial epicondylitis, which is golfer's elbow. Anyway, so give me a call. I want to hear from you. The phone number to the studio right now, and you can talk to me live, is 866-870-5752. That's 866-870-5752. Don't be shy. I don't bite too hard. Just kidding.
Oh, you don't. You don't. You're very gentle.
Just nibble a little.
Can I just share that when people call the program today, they will get your latest book for free?
Yeah,
It's
absolutely.
called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it has actually 264 scientific studies within. So if this is a new paradigm for you, you might want to call in and ask for the book, because science speaks louder than old ideas. The old ideas are
Old.
They're arcane. They're just yesterday's news.
Yeah, exactly.
We live in today.
Right. And, for me, I've seen way too many bad results with surgery. Everybody who listens to the show and my patients know my story of my shoulder surgery that went bad by my boss during medical school, who I love. He was a great guy. And I never blamed him. It just went bad. And I had a few years of miserable swelling and pain and decrease in range of motion, and didn't know what to do about it. And then finally I discovered regenerative medicine. I injected myself one night. And the funny story about it, Nita, you know this, you know my wife, Michelle. She was in bed watching TV, so I jumped in bed and I had a syringe in my hand. And I pulled the cover off and got ready to inject my shoulder, and she was yelling profanities at me like, what are you doing? And I said, well, it worked on my wrist. Someone did it to my wrist and it healed up after a golfing injury. So I wanted to try it on my shoulder. And it was really amazing for me, because the wrist injury had been hurting for years also. And I had problems writing and doing my work. And that healed about 50% overnight, within about 24 hours. And then I learned how to self-inject, and I did my own wrist maybe 4 or 5 times, because I never really let it heal. I didn't know back then that you had to let things heal. So I would inject it, it would get better, then I'd go play golf again or tennis again and beat it up again. Then I'd inject it again, and then I learned that in order for things to heal and the new tissue to grow, stop beating it up, let it heal. So then I did my shoulder, and that one was even more amazing. That was a one-time deal, and it healed overnight. And I know you had stuff with your neck that we worked on. How many treatments for the first time you injured your neck was it? Was it 1, 2, 3?
Treatment.
One time the first time, yeah.
4 shots.
So
better in a week.
People always come in and go, I want stem cells, and I want to walk out of here and fly to the moon, And I'm like, it's not like that. This is not a magical cure. Regenerative medicine with platelets, PRP, and stem cells is not magical. It just makes sense. You're putting your cells back into the areas that are injured, and what that does is it stimulates the tissue to regrow. So it's not magical. And then they say, will I be healed the first time? And I have to honestly say, I don't know. I don't give anybody any guarantees. Everybody's, I'll use the word karma, is different. And everybody's injury is different. So these are things that we can't predict. And some of what I think are going to be the easiest healings, someone just has a sprain in their back or their ankle, sometimes takes a few treatments. And then the opposite will happen. I'll have people with advanced arthritis in a shoulder or hip or a knee or something like that. And they'll say, how many treatments does it take? Nita, you're breathing. That must mean we have a caller.
Debbie in Camarillo awaits.
Okay, I'll stop talking. Hey, Debbie, Dr. Marc Darrow, did you have a hip replacement or you need to get one?
I've been listening to you for years. You're great.
Good, thanks. Thank you so much. I appreciate that.
Well, I've been trying to get through because I think this is important what I have to say for people that are getting hip replacements. I'm very athletic, and I had a knee replacement. This is before I knew anything about you, and that was fine. But when I had my hips done, right away I had a 1-inch leg length discrepancy, which I have found out now is pretty common. And I had to have another surgery, a big surgery, to change it. And I still have a half an inch, and I have to wear a special thing in my shoe. I limp. It's so that's something. I don't know if you can do anything about that, but it is important for people to know because that is something the doctors don't tell you. It happens.
Yeah. Well, good doctors will tell you, people that are not hustlers, who are persons, they will tell you. But, sometimes the surgical personality is just to do the work rather than to communicate, and that's unfortunate. But that could be with any kind of doctor. And
is there anything to do about that at all?
Let me ask you what the problem is. I know you have the leg length discrepancy after the hip replacements, but what is the actual problem you're experiencing?
Well, even when I wear I have a special orthotic that I had made. My balance is not good at all.
Okay.
I have the leg that I have the hip done and the knee done is I get ablations every 6 months. Obviously, you know what that is.
Yeah.
But I have maybe you could explain that a little bit. And I have pain in that leg.
Okay.
I feel like I'm never going to, people will say to me, why do you limp? So, and I do.
Okay.
Not having another surgery to make it shorter again.
You know what I find? Typically, if you have a surgery and it goes wrong, the second surgery often goes more wrong. And I don't know why that is. There's some reasons I do know. There is a psych test that I think it's called the MMPI. Is that correct,
Yes,
Nita?
it is.
Okay. So back in the days when I started doing medicine, surgeries were not done until an MMPI test was administered. It's a psych test that shows if you're a good surgical candidate or not. And some people, and Nita's a PhD psych, so she knows more about this than I do. But what I remember, because we had to take the test in medical school, is that some people are not good healers because they take their physical stuff and put it psychologically or vice versa. And it's like if someone's depressed, they get pain. If someone's in pain, they get depressed. So there's this vicious cycle. And I don't ever see any surgeons now doing that test. I haven't seen that in, 20, 25 years being done. And there are some people, no matter what surgeries you do, that are just going to have a failure, okay? And I'm not sure. Nita, do you know anything more about that?
Well, I know it hasn't been used for that in a long time. You and I had talked about that. But the other thing is that we have to look at this phrase you taught me years ago, which is follow the money.
Well, that's a different story, though. Yeah, that's a different story. We'll get into that maybe later.
Okay.
But I don't ever want to say surgeons do surgeries to make money, because I just don't like to say that. Because
I don't think it's the surgeons. It's the system.
It's the system.
It's not the surgeons. They are fabulous and talented.
They are fabulous.
And we love them.
We do. It's just that, to me, these surgeries should not be done for the most part, because we have something that's been around a long, long time. Actually, regenerative medicine has been on the planet since the beginning in different cruder forms. But now it's simple. It's just injections. Back in the days of Hippocrates, the father of Western medicine, he would use branding irons to create scars which would tighten up dislocating shoulders of the Olympians. Well, I wouldn't want to have that done. If I get people that have dislocating shoulders, I just do simple injections to tighten up the rotator cuff and the joint capsule, and their shoulders stop dislocating. So medicine is moving forward, but I'm not sure surgery is moving forward enough with it. because I think that the surgeons ought to be trained in regenerative medicine so they have the option. They don't believe in it. And when I argue with my surgical...
They really don't believe in it.
And you know what happens that's very funny, Debbie? By the way, I'm going to give out the phone number again so we can pick up some people, but you hang with me. To talk to us live right now and get in the discussion, you can call 866-870-5752. We'd love your call. You can use a fake name. If you're shy, pretend it's your dad or about your mom or something like that, or your best friend. But give us a call, 866-870-5752. And if you don't want to talk live right now, you can call me at the office and to get more information there. The office number is 800-300-9300. And for those of you who want to watch these videos of me doing the work, we've got tons of videos on the website, which is www.lastemcells.com. I'll repeat it while you're jotting it down. www.lastemcells.com. And you'll get tons of pages of information about how this stuff works and how you can save yourself from a invasive surgery by just coming in the office, walking in. You don't need a driver. You walk in, you get some injections, you walk out, and we just use your own cells from your body and just take them from your blood or your bone marrow and put them right back in where the problem is. And Debbie, by the way, how old are you, Debbie?
I'm 68, but my body is, seems not is a lot younger because I do kickboxing. I do.
Oh, good.
Spin 5 days a week. I definitely overdo, but this is important. When I had right away, in a matter of 2 days, I could tell the leg length was way off. And when I went to my surgeon, because a lot of doctors told me afterwards that if he had gone in right away and fixed it, I would have never had this problem. But he wouldn't do it. He just said it'll heal. So was that a mistake by him, or does
that? I don't know. I don't know. It's tough to nail doctors with the word mistake because it's their medical opinion of what the best thing is for the patient. So,
okay. The other thing that I want to do, if you could just explain ablation, because most people don't. I never knew what it was.
It means you're burning a nerve. You burn a nerve so it doesn't transmit pain to the brain. So the nerve is we'll call it put to sleep, because a lot of times you do a nerve ablation and then the nerve grows back. So that sounds like what that's happening to you because you do it every 6 months. It's not something I love the idea of. Who wants to burn anything in the body? And same thing with surgery. Who wants to cut anything in the body when you probably don't need to? Now, I get a lot of people that come in literally every single day who say, I need to have a joint replacement. And I do an examination and I go, you don't need any kind of joint replacement. You don't even need a surgery because we can help you by injecting your own platelets back in the body, do PRP or your stem cells. And they say, but I have bone on bone. And they bring out their x-ray. And I go, you might have what they're calling bone on bone, but it's not really bone on bone, and your joint is moving. If the joint doesn't move, like were you able to walk when you had your hip replacement, Debbie?
Am I able to walk?
No, before your hip replacement, were you able to walk?
I really don't think I ever needed it, or a knee either.
Yeah.
I never was in a lot of pain with any of them.
I'm going to tell you a story.
A little bit, not really.
I'm going to tell you a story, so this will give an idea to people what's going on. It relates to you. I have a patient who I adore. He lives up in Santa Barbara. I hope he's listening. I won't give out his name. And he is a very wealthy man, and I'm going to say it like this. He's very spoiled because of his wealth, but he's a very, very wonderful, nice person. He'd take the shirt off his back and give it to you. So he's an ardent golfer, and he came in with some hip arthritis, and I said, I think I can help you get better. And he said, but I know all these guys that have hip replacements, and that's what I think I want to do. And I said, well, give this a try. So he would come in, and he would get stem cells in his hip, and he'd get better. And then without following my orders, he would go play golf a few times, even several times a week. And then he'd call me up, and he'd say, my hip hurts, so this isn't working. And I said, it is working. You're not working it. And he was frustrated because he has, he's entitled. Let's just say it the way he'll admit it. I'm not saying anything bad about him. He's entitled. And he doesn't want to have to go through this, which is a process for some people. Sometimes it heals overnight and sometimes it takes several treatments. So he calls me all the time for support. And he called me up yesterday. He was driving home. And I said, where are you driving? He goes, I was just down in Santa Monica, and I went to see a surgeon there. I won't mention the name, who's a really good hip surgeon, by the way. And I know people have... Well, I'm just telling you the whole story here, right? So he said, I'm getting a hip replacement on September 7th. And I said, okay, I support that. I support him, you know what I mean? And I don't want to implant in him that it's going to go wrong, because a lot of them go wrong, like yours went wrong. So I didn't say a word, but I'm hoping that the light goes on, because his wife doesn't want him to do it. And he really is not that bad, to be honest with you. He gets around fine. It's just when he overdoes it, he gets sore, and he hasn't done enough stem cells yet to really create a healing response for him, because he goes and beats it up before it's healed. So we have to be very careful. And I know for myself, I've been injecting myself with regenerative medicine for about 25 years or so. And I find that when I listen to what I tell my patients, I heal up, and when I don't heal up as fast. And I need more treatments. If I go out and do sports right away on the area that's been injured from the same sport, what do you think? So anyway, in answer to your questions, the ablations are done in your low back, right?
Right.
Okay. And that's because what happened with your hip replacement leaving you with one leg longer than the other, the spine now is out of alignment. All right?
Correct. Yeah.
Okay. Now, ablations are not the way to handle that. Do you have any back pain?
Oh, I have a lot of back pain.
Okay. So you need to come in and see me.
What could I do?
You call up the office, 800-300-9300.
So you obviously you can change the discrepancy, but you could take away the back pain. Is that what you're saying?
I'm not promising I can do anything, but I want to look at it.
I know that, but I'm saying that could be a possibility instead of ablations.
Well, it could be a huge possibility because the ablation is not fixing you. What we want to do is do something permanent with the healing.
Oh,
I mean,
yeah,
it's obvious. It's obvious what happened to you, and this happens to a lot of people who have hip surgeries. They end up with back pain afterwards. Not everybody. Some come out great, but a lot of people have big problems with it. There was, I talk about this on the show. There was a woman. I did my internship in Denver, Colorado, and I was assisting on a hip surgery, and the woman on the table died from the anesthesia. Right there in front of us. Not from the surgery, from the anesthesia. I don't like surgery, get it? That's just me. I'm not saying what's right or wrong. I don't like it. I've seen bad things happen to my patients. I've had a bad thing happen to me, and I'm just not into it. Sometimes it has to be done. There's no question of it. But it's so rampant now. It's the culture. And in my little opinion, I'm just the little guy, I don't think it should be used as frequently as it is. And it sounds to me like you never needed yours, and it caused you problems from what you're telling me. That's just the way it is.
Call. That sounds wonderful. But that's what I'm saying now. I don't think people know that hip surgery is very easy as far as I healed really fast, but it changed one problem to my back. And my back was perfect. Never had a back problem.
Well, you're very fortunate that yours healed quickly, because I have patients that literally never heal after a surgery like that. They can get an infection, osteomyelitis. That's a lifelong friend that keeps coming back. I've had people who have had problems where the joint doesn't fit right. I mentioned before on the show that a man came in with a shoulder replacement that the prosthesis didn't even fit from the arm into the shoulder, and he couldn't move his arm at all afterwards. I mean, I see these things. I'm not trying to tell you it happens all the time, but it does happen. And I'm not a gambler. I don't go to Vegas. I don't like Las Vegas. And therefore, I don't like surgery. With all the sports injuries I've had, I probably could have been operated on 20 times. But the one on my shoulder that failed was my wake-up call. You can hang with us, Debbie. We're going to the break real quickly. For those of you that want to talk to me, the phone number to the studio is 866-870-5752. You can watch me on my website, www.lastemcells.com, to see the procedures.
Okay, and you're listening to Living Pain-Free with Dr. Marc Darrow, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.